All right, if you're just joining us, we're in the last leg of the show. But of course, to close it off, I want to introduce you to a great gentleman who is doing amazing work in the world of surgery, more so the cleft lip. We're going to learn more about it and the work that he is doing. Allow me to introduce this morning Dr. Meshak Onguti. He is a practicing surgeon. Thank you so much for your time this morning, Daktari. This is something that is not so popular in terms of knowledge and information. Just help us understand what cleft lip is and the causes behind it.
Thank you very much, and thank you for giving us the opportunity to talk this morning. Actually, cleft lips and palates, they have a very significant effect on someone's life.
Right.
Although they do not carry the same attention and care. And it's mainly because the initial impact when a child is born with a cleft lip and cleft palate, it is so devastating to the families. And that child is affected from many things. One, obviously is not going to cry or eat properly. So from the word go, they have serious problems of how to feed this child. And the features, how they look like when they come out, they can't even show that child to the relatives when they come in place. So from the word go, they tend to play it cool, hide those children so they don't come in. And as they grow, they cannot even be able to communicate and talk properly. And you know, the human life is that you must be able to communicate properly.
So it's a problem that children are born with?
Yes, because that's what I was coming to. So cleft lips and cleft palate is basically what it means. They are abnormal gaps, or like a furrow, like a drain, like a lift furrow. You see, these things separate. They don't join together so that they can form a normal thing. In this case, the lips, where you find that the child is born and you find the lips are not joined together properly. So there's a gap, and you look inside. And the roof of the mouth also there's a gap or a defect that occurs. And it occurs, you know, the face develops when a mother conceives. Okay, the face develops the first 4 to 8 weeks, the face is developed. And that's the time, you know, when people don't even know they're pregnant. And so many things happen to it. So it's a congenital. Someone is born with it. You don't acquire it. You're born with that defect. Most of the things that we are concerned about, that, you know, the first question the parents is, how did this come up? In fact, you find that in the past, because of the myths, either the husband would say that you chase the wife away, that you brought this problem, you're a curse you brought to us, and what was happening now. And from the word go, you really put someone in very serious psychological problems. You know, their social life becomes not only the child, but with the mother and the parents that are doing it up. The other thing that complicates is that these kind of problems, they are not easily managed because they require very highly skilled and trained personnel, not only the surgeons, but even the anesthesiologists, the nurses, who know how to take care of these patients. And who also have special care in terms of feeding them, in terms of training them how to speak. And this is not available everywhere in the country, but it is available in very few centers where they can be done. And the other aspect that, look, because of that, it means that treatment of these cases are very expensive. But unfortunately, a lot of these people who get these problems, when you look at them and when you talk to them, you find that they actually have nothing, first of all, even to feed those children. Because when you look at those children, if they are children, you find that they are actually affected, they are malnourished, that means they didn't get enough food to eat, they cannot be able to, you know, clothe themselves. Some of them, when they come to the hospital, they don't even have the simple things like napkins. And the workers have to contribute towards that aspect. So basically, that is the overall picture of what these clefts are. They are clefts that are normal. For example, that if you look at the upper and lower jaw, that is open. That's a cleft. If you look, for example, you know, like the ano area, if you didn't have the area, you cannot pass stool. So it's a normal cleft, for example. The eyes here, you see they are opened up. That's a normal cleft. But when you find them where they are not supposed to be,
now that's a problem.
That's a problem.
All right.
Yes.
Now, Doctor, you've mentioned that there's the aspect where a lot of communities and people hide their children, and even husbands go to the point of saying that you had mentioned that this child is cursed. How do we begin to break that stereotype around cleft lips?
I think what you've done is that, look, any child who's born, I mean, he can live a normal life just because they have that deformity. Remember this way, people can get deformities acquired in old age. People get accident, they lose their eyes,
Right.
they look their leg, they lose an hand, they can use both limbs, for example. But you realize what happens is that how do we react as a society? Unfortunately, in the rural areas, you find people, they even tell their children not to go to that home because they think that it is something that it can be infected, it transmitted from one other place. They say, no, that place I've got problems on. So what you need to do now is to educate the public and know that, look, when they see these kind of children, they should encourage the families that, look, there's treatment available, surgery is available for them, they can be treated and become normal people, and they could actually be able to live a normal life, go to school properly, they can become doctors, they become engineers, they become ministers, they can become even presidents in future, because you never know, because this is your normal part. There's nothing, mentally they are very perfect. There's nothing that's there.
Okay, so it doesn't affect also their mental capability?
It doesn't, although sometimes when there are people sometimes when they have got this kind of problem, they also have the problems, for example, like they might have had that problem, they might have, we saw a kid recently who had also, the big head, so they do occur, but these are isolated cases.
All right, so doctor, you said that the head is the very first thing that is formed during pregnancy, like the first 8 weeks, which is quite important. And now with that background information, what is it that happens, biologically speaking, that causes a cleft lip?
Yeah, so basically what you're asking that what actually causes clefts in the normal life.
Yes.
Now, if we knew the answer, we could be able to prevent that from the get-go. But we know things that are associated with it. One of those is we can call it malnutrition or undernutrition. Where you feel you don't get, you are eating, but the food you are eating doesn't have the necessary thing that you require when the cells are developing, that young age, when they are trying to join together, like, for example, folic acid or vitamins, multivitamins, for example, that are supposed to be in place. So what happens here is that if you look, what we have found out, many of these mothers, and if you look at it critically, because when someone is pregnant, even the first 1 month, sometimes they're not aware they're pregnant. They will feel that they will be nauseated, they will feel that there's some funny things. And if they go to a place where someone cannot be suspicious and think that that's the case, they even prescribe some drugs. And more so those drugs that they say, look, you have something wrong in your head, maybe you're stressed.
Right.
So they give you those antidepressants. Those can affect the children at that particular age. The other two is that if you eat this food that, like in our rural areas, a number of mothers, if you look at it, they eat food, but it's not nutritious. So that also can play a major role. And one of the things that we can be able to do in the future is to make sure that, look, for those mothers who are planning to have children in those particular areas, for example, or 4 months before, they can be put on the supplemental nutritions like folic acid, so that, and they continue maybe 3, 4, 6 months during the pregnancy to avoid these things coming in place. The other thing that is there's environmental operation, particular things like chemicals.
Wow, it plays a big role?
Yeah, big role. Anything that will have, cells are dividing. When they must divide very fast, they can form and divide and form and move so that it can make the face, make the eyes, make the mouth, make everything that's supposed to be there. Then begin moving on to the stomach, to the, all the limbs. At that time, you require an environment that is conducive. If there's anything that comes in between, so it prevents things being assembled properly, then you have that particular effect. The most important one also now we are finding is about alcohol and smoking, particularly if mothers to be are smoking and doing that. And that's why it's always good that if someone is smoking, she should not even smoke near where the children are or where the mother is. But you see, sometimes people think that it's their right to smoke. But I think it's not their right to smoke because they are actually causing effects in other places on. And if they do that, and they are smoking, they're having alcohol and everything, and all these combinations make it more accessible for people to have.
All right, Dr. Meshach, show us how you go about the surgery with the charts that you have this morning.
I'm actually, if we are able to...
I probably should hold this for our viewers.
Okay. For the viewers.
Yes.
Yeah, this is the, see, if you look at there, what you're seeing, that's the kind of defect that's there. You see these children who are born with the clefts, the gap in between, but they're fixed and become normal. And you can see a child like this one here, and you see how he looks like. Look at this person in the mouth, who was like this, that hole, but you can see, I mean, when it's done, he actually becomes normal. Now, what we have found out is that this is not only children. There are many adults also in the rural areas who actually do not know that this can be done. They were told that, look, God created you like this, and therefore you can be able to do this.
How long does this surgery take to perform?
It depends what type of surgery. It goes from 1 hour to 6 hours. We are doing both in the outside and inside the mouth. Yeah, and because of that, what we normally need is that we examine the patients, because, and remember, treatment of these patients is not only once.
Are there cases where people have gotten wrong surgery?
Now, Lily, what happened that you see, technology and skill has improved as many years come along. You see now, we are talking about, for example, that you have the CT scans, the ultrasound, the modern ones, you know. So there are patients who are done long before, when the techniques and everything were not very good, but they accepted it.
Right.
But you see, those people can actually come back and we revise everything else. Or the people who are done and they have holes in the mouth still. The food is leaking through. Can you imagine when you're eating and food is coming through the nostrils? So those people don't eat in the public. They actually go and hide. That's one of the reasons why you don't see them. Okay.
Yes. So, Dr. Meshach, allow me to close off the conversation there because of time. But thank you so much for helping Kenyans this morning understand the issue of cleft lips, the fact that it is fixable, and that we need to begin breaking the stereotype behind this, that this is a medical issue that can be fixed. Yes. Thank you so much.
Yeah. Maybe you might have said one thing, because actually we're having a special program going on in Nairobi Hospital.
Right. This morning.
This morning, which is today and tomorrow. All the patients that we are treating them there, and we should thank Nairobi Hospital for at least allowing this patient to be treated there free of charge, which is a very special thing that is required in place. Yeah.
All right. Thank you so much, Dr. We'll leave it on that note. As you've heard from Dr. There will be free surgery going on at the hospital, courtesy of Nairobi Hospital.